So good to see you all. It's good to be in community with all of you. Oh my gosh, why am I? Hold on. I'm not sure what happened, but here we go. Okay. So when I was a little girl, my mom was a Head Start teacher. And on the weekends, I would go with her to other Hmong family homes. We are Hmong American, and I would go with her to other Hmong family homes. And these were homes that looked like ours. They were small, they housed multiple generations, and there was always a pot of rice or greens on the stove. They looked like our house, they smelled like our house. And I would sit with her, or I would play with the other kids while she sat at the dinner table or in the living room with the parents, the adults. And even though I was little, I remember hearing words like Medicaid and prescription. And I would remember her asking people, these parents, questions like, this prescription says to take two a day. Are you taking two a day? Are you following what the instructions say? And I see here that your next appointment is in a couple of weeks. Do you need me to go with you? And I didn't know it then, but she is the first community health worker that I've ever known. And years later, when I got my first big girl job at the local hospital, I found myself in that very same role where the ladies from the church would come to me and say, "Hey, we heard you started working at the hospital. Can you help connect us? Can you help connect us to these resources? Can you help us understand what this paper means?" And I got this letter, this message from my doctor, and I don't understand what it means. Can you help me make sense of what this means? And so I tell that story because as CHWs, a lot of us don't realize that we are doing CHW work. A lot of us don't realize that that's what we have been doing, taking care of communities for many, many years without the recognition, without the title, without being paid to do so. And so I am just honored that I get to serve in a role where my whole job is to advocate and really represent the workforce in North Carolina and advance priorities that are so important to us as a profession. And again, not just in our state, but nationally. So let's talk a little bit about the North Carolina Community Health Worker Association. The initiative in North Carolina started in 2014. And make no mistake that even though the initiative started in 2014, community health workers have been doing work for many decades, long before the title community health worker ever existed. And in 2019, we pulled together a team of community health workers. I was a part of that team, and we formed the North Carolina Community Health Worker Advisory Committee. And one of the things that was really important was in 2020, right as the pandemic was getting ready to just rear its ugly head in early 2020, we had launched our standardized core competency training. And it really was an opportunity that really shone a light on how important community health workers are. And of course, in 2021, we formalized the Community Health Worker Association as it is known today. So, just to give you all a little bit of a background and a history about the organization, we see our roles, our work in four different buckets. We, of course, are all about advancing community health workers and elevating the health of the communities. But as we look at our work, we see our work in four different areas: advocacy, credentialing, training, and sustainability. And you see that here on this screen. And I'm going to go into each one a little bit and break down what this work looks like. As we're thinking about advocacy, We have had three successful advocacy days in North Carolina. Here are some of our CHWs on the screen. And while, for a lot of CHWs, this was the first time that they have engaged their lawmakers. This was the first time that they have ever spoken to their senator, to their representative. This was the first time that they've ever been at the Capitol. And so this was an opportunity for us to galvanize community health workers who, while they have been doing this work all their life, we've heard, I'm really scared. I'm really nervous. These are people in positions of power. What do I say? And it was an opportunity for us to recognize the fact that, hey, you have power just like they have power. You have a voice, and these lawmakers are accountable to you. And so, this is an opportunity for us as a workforce to get in front of these people who make decisions about us and tell them our stories. Tell them about what's happening in our communities. Talk about what's important to us. And so, the advocacy piece of this work is so critical. And while we've had three successful advocacy days, what is important to know is that we have been doing this work for more than 3 years. There have been more than 3 years of advocating for CHWs and communities than the 3 years that we have been able to really successfully launch an advocacy day in North Carolina. These are some CHWs from Region 5. We're really excited about the work that they're doing. And as we're thinking about what that looks like in North Carolina, what's also important is that we've also taken CHWs to our nation's capital. And in partnership with our friends at the National Association of Community Health Workers, we've also been participants of 2 Hill Days at our nation's capital. Again, getting in front of our lawmakers to tell them about what's really important in North Carolina, about the priorities that exist in our communities, and that they really should be listening to community health workers and community members from the ground about what's important. We've taken a little bit of a different approach this year. This is a map of the state and the different regions. These are the Medicaid regions. And as we're thinking about the different approach, what we heard from community health workers is that because all of the needs are so different from region to region, it was important for us to think about advocacy at the local level. What would it mean for CHWs to engage not just those senators and those representatives at the local level, but what about those county commissioners? How about the school boards? How about the Board of Health in every single one of the counties? And so through our regional networks, we have switched gears a little bit to focus a little bit more regionally about what this looks like. And we are just getting started. There is absolutely more to come, but our advocacy work absolutely is thinking about not just the approach from the national level, but what does it mean at the super local level where we live every single day, and how to really engage lawmakers and decision makers at the local level to influence decisions to build healthier communities. So let's talk about credentialing a little bit. In the state of North Carolina, we have 1,000 and counting community health workers who have earned and maintained their current certification. And we are so proud of this number because as we talk to our friends across the country, they stand in awe of all of us about how we have been able to really engage the CHW profession across our state and get to 1,000 plus community health workers who have been certified. So we're really proud of this number. We're really excited about what's coming. And on top of that, I think it's really important to share that we have also just implemented and have organized our credentialing commission. So this is a governing body. The Credentialing Commission is our statewide body that oversees all things credentialing. And at least 51% of our Credentialing Commission are CHWs. Underneath the Credentialing Commission exists two councils, the Training Council, who approves CHW trainings. They're responsible for updating our standardized core competency training that is delivered through the community colleges. This training council is also responsible for approving instructor applications and community college applications. And then also we have the Certification Council, and this council is responsible for reviewing individual applications, specifically our legacy track applications and our advanced level applications, and to ensure that they are in good standing. And this structure is so critical because as we continue to talk with community health workers across the state, what I continue to say in my spheres of influence and to other community health workers is that we want to bulletproof our profession. We want to make sure that nobody is questioning the skills or the competencies that our CHWs have when it comes to the work that they are doing in their communities. And being able to bulletproof them means that we have to make sure that the structures exists inside of our internal systems and structures to really support and protect the workforce. So we're really excited about what this means for our workforce and excited about the fact that this work is really led by CHWs for CHWs. We also have been working really hard on training. And so as many of you, I see lots of familiar faces. You all may know that our curriculum is delivered through the community college system. We have approved 18 community colleges out of the 58 different community colleges across the state. 18 of those colleges have been approved to deliver our curriculum. And we also have what's called specialty training. And these specialty training opportunities, it's an opportunity for different organizations who want to provide training for CHWs to have their training vetted and approved by the association. It's another stamp of approval that says, hey, CHWs, if you want to take a really solid training, we have these options available. So to date, we have had 5 approved trainings under our specialty track. And this is an opportunity really, again, to invest in our workforce, to really build professional development and to see our profession grow, and really to excel at what they're doing. We're also pretty excited that last year we wrapped up our first ever CHW employer survey. And this is exciting because this was the first survey ever that was developed by community health workers. Developed by community health workers, led by community health workers, for community health workers. And I'll be happy to share that report with all of you. But what we're hoping to see is that this data is going to help us understand how we move forward. And this year, in 2026, we're going to be launching a CHW specific survey. So if you're a CHW, be on the lookout because this survey will be coming specifically to you as a CHW, as we have already had a conversation with the employers through this first survey about what these programs look like. But now we're gonna flip this and listen to the CHWs themselves. And again, this was all designed by community health workers who really led the charge in helping us design what this should look like. And then as we talk about sustainability, we have been working really hard at the association to advance a comprehensive statewide community health worker strategy. What I'll say here is that a lot of what we see as far as programmatic efforts across the state are very siloed. And what we have been really advancing to our partners at the state, to our partners at the legislature, is that we need unified collective strategy to advance our profession. There's a lot of divisiveness, and we've got to bring our profession together. So we're pretty excited about efforts that are coming. It's slow. It is slow, but definitely closer than we've ever been before. We have been working with partners, for example, at North Carolina AHEC on what CHW integration could look like. So having conversations with multiple partners, multiple organizations about best practices to align integration priorities and strategies, again, to advance a comprehensive statewide strategy that is really collective of all of our efforts. When we talk about reimbursement, we know that there is Medicare reimbursement at the federal level for community health worker services. But in North Carolina, we still don't yet have Medicaid reimbursement. And so we're continuing to have conversations with our state partners, with our insurance providers to think about what reimbursement opportunities could look like for CHW services. And lastly, what I'll say here is that we are a part of a large national movement. Again, as we talk with our friends from across the country, a lot of states look to us for leadership when it comes to how we choose to lead in North Carolina. Really proud of how we have chosen to do work here in North Carolina and excited about what's to come. But there is a national movement because lots of states from across the country are looking for how to sustain CHW programs, how to make sure that CHWs are thought of just like nurses, just like physicians, just like any other integral member of the healthcare team and not just an afterthought. So we're really excited about what's coming as this movement continues to strengthen and advance. And then lastly, we've got a picture of our regional networks again, because there is a lot of movement that's happening across our state. I really encourage you all to plug in to your regional network. We have 6 really active regions that are doing a lot of really solid work with CHWs, engaging CHW leaders and allies to really advance what our profession needs. And happy to connect you all to Dulce Ortiz, who is our statewide engagement manager. Adia is here. I see Adia here on the line. She is our region lead and our regional lead for Region 4. But there's a lot of work that's happening across the state, and I really encourage you all to plug into these regional networks to learn more about what's happening and connect with those local CHWs who are doing such tremendous work. And then lastly, just to thank you, I want to absolutely leave time for questions and conversation. But thank you all so much for having me. And of course, I'm always happy to answer any questions. So Hanya, I'm going to pass this back to you, and I'm going to stop sharing my screen.